And then the symptoms of menopause, the impact it has on individuals and our society as a whole, and then what options you have for treatment and why you might want to consider treatment. And I'm talking about kind of all the range of symptoms of menopause, but this definitely is a phase where if women have not had symptoms of thinning hair, that often starts in menopause and perimenopause. And we don't have a lot of data about specific hormonal treatment for hair loss, but it is part of the kind of package of treatment of trying to mitigate the hair loss, even if someone has started with hair loss or earlier in their life. The other thing I wanted to mention is that we still have very limited data about menopause and even less than about perimenopause. And so I'm giving you the best data that we have, but we still have lots of questions and some that we may not be able to answer with research, but hopefully we will in the future. Okay. So just some definitions here. So menopause, again, it was really just one day, and that's after you've had 12 months with no menstrual period. The time leading up to menopause is perimenopause, and that can be, 7 or more years before you hit that final day. And then when we talk about postmenopause, when people say they're in menopause, it's really the postmenopause phase, but we usually just shorten it. So those are kind of the 3 phases, and there's kind of sub phases within that, but that's just kind of the range. And perimenopause can start really as early as the late 30s. And you can still be having completely regular periods, but still start developing some of the symptoms of so periods could change. They could become more irregular, heavier. Oftentimes women will have to go on birth control years after they've needed to think about it just to be able to manage their periods. You can start with hot flashes and night sweats. Sleep difficulty is one of the more common things early in menopause, and mood changes, irritability, weight gain can start to happen. And then, fatigue, decreased libido, all things that are very subtle sometimes and can be overlooked by patients and their providers. So there's like 39 different symptoms that are part of the menopause picture. So you're not going crazy. And then in menopause, the periods will stop. Like I said, the hot flashes sometimes will worsen in that early menopause phase, but then some of the other symptoms can sometimes go away as you kind of adjust to this new normal of a lower estrogen level. But then one of the things that then really does start to pick up the longer you are without estrogen is the vaginal symptoms. Vaginal atrophy will happen to everybody at some point without estrogen present. And so we'll talk about ways to treat that, but it is not something that people need to live with for sure. Urinary incontinence, urinary urgency symptoms, having to wake up at night just to pee, also as part of that picture of genitourinary syndrome of menopause. And then a silent thing, but something that we definitely pay attention to is decrease in bone mass. And so the peak bone mass happens in your late 20s, kind of stable through the 30s. But then once you hit perimenopause, starts to go down, and the phase right around the transition to menopause is the highest period of bone loss, and at a time when you really are not necessarily thinking about that. So it's kind of a silent symptom. So those are all the symptoms. What's the impact on again, women and society? We, especially as we're living longer, might spend up to 40% of our life in menopause. And so it is definitely something to pay attention to. 20% of the workforce is in either perimenopause or menopause. And women who are dealing with significant symptoms are 8 times more likely to have difficulty with their job. And some will even leave or retire early because they're unable to manage their symptoms at work. And then in some people, unfortunately, they can have the vasomotor symptoms, the hot flashes, feeling sweaty, waking up with night sweats for up to 20 years. And that's, again, a huge portion of someone's life. Again, the genitourinary syndrome of menopause is not symptomatic in everybody, but everyone will eventually develop it. But half of women are really bothered by it. Major cause of sexual dysfunction, and which then is a stressor for relationships and personal stressor. And then, just thinking about the genitourinary symptom of urinary tract infections. Medicare could save billions of dollars if we actually got everybody treated effectively for that. So again, this is a major impact. And there's we also don't want to necessarily think of it as a disease, because it's normal aging, but there's ways that we can kind of mitigate some of the negative impacts.